I'm Dr. Rasmi. I'm a neurologist working at Apollo Nellore. I'm a consultant here. I have completed my neurology from Kasturba Medical College, Mangalore. I'm here to discuss basic topic in neurology, which is nothing but seizures, which we all be addressing as fits and all, right? So, okay, to discuss regarding fits, which is a general terminology. So I would like to tell you what is a seizure, what is a fit. So we all know that the brain is the center and which is the control organ of our body, right? There are like millions and trillions. To be specific, there are about hundreds of trillions of neurons which are working continuously. Even as I'm speaking right now, they are all working in my brain, body, and all. So they will be working smoothly with releasing chemical substances called messengers, neurotransmitters, which will be going on. But at a point of time, when these neurotransmitters or when these chemical messengers are not functioning or not uh, being like functioning properly, or they are excessively firing, and that is like an abnormal thing which is happening. So this leads to a spark, like it's hypersynchronous activity in our brain, which causes seizure. It is like a spark, just a spark. So this causes fit. Okay, we all will be seeing some person will be like shaking all hands, legs. Some person may not be shaking all hands and legs. So there are actually different types of seizures. So they can be like, we usually call them as focal seizures, generalized seizures. Sometimes it can be focal, it can be both initially focal, then generalized. Sometimes we don't even know. So what does the difference that is make? Oh, how are we going to classify? It depends on from which part of the brain they have started. Okay, so if it has started from focus point or how it has been symptomatically being presented, so this all makes a difference in the presentation of a seizure. So we all know that, but how to tell that is it is a true seizure or it is just a false seizure or a pseudo seizure? So better, the best thing is to describe the seizure properly, to describe the episode properly. So we usually, neurologists, we usually ask, how did it start? Was there any symptoms before, like the aura symptoms? Like patient might be just complaining of headache, which is a minor thing, and they will be usually neglecting that complaint. Or there were patient was seeing something, or patient had some sensation in the throat, sensation in the stomach, or was not able to feel hand properly. These all are the aura symptoms, like pre-ictal state. Ictal state, this describes the patient, how the patient was during the seizure, like how the patient has turned the head or the eyes, how they have turned, which hand was problematic initially, which leg was, where did they notice it first. This all makes a huge difference to tell whether it is a true seizure or not. Then associated complaints, symptoms presentation, like whether the patient had tongue bite, whether the patient had frothing, whether the patient had involuntary maturation, how much time was the episode, and how did it follow later on, whether the patient was drowsy or just like that she just became all right, he or she became all right. So this all makes a difference to tell whether it was a true seizure or not. Then coming to, we even tell that an epilepsy, right? So epilepsy is nothing but, when as per the definition, I'll make it clear that if there are two two particularly two unprovoked seizures which happen more than 24 hours apart. So one seizure might be happening now, the next seizure should be 24 hours later. Then we describe the term epilepsy. So if it is only a single fit, we usually don't describe it under the seizure, under epilepsy, unless and otherwise it is categorized under epilepsy syndrome. And the patient may be presenting with many other complaints, many other symptomatology of the epilepsy. It can happen, this seizure can even happen due to a developmental defect during, even before the birth, after the birth, that the patient might be developmental abnormality in the brain can cause seizure. There can be even after birth, there can be an infection which has caused the seizure, or there can be metabolic problems like sodium defects or sugar defects can cause a seizure. Mitochondrial defects can cause a seizure. So even a stroke can cause a seizure. So there are many causes for a fit. Okay, and this fit becomes epilepsy when there are two which have happened more after 24 hours, or even if it is a single seizure, and the tendency to recur after might be, if it is more than 50% chance for a patient to have a tendency to happen one more seizure, then we call it epilepsy. So as I have told, whether it is a definitely seizure, we usually symptomatology of the seizure. So the person who explains us to us how it has started, how it has progressed, and what were the signs or symptoms occurring during that time, they are very, very important for us. So I usually tell the patient, so take care of the patient means just make the patient lie down or without any object surrounding him or her, to make the surface clear so that he or she does not hit herself during the seizure. Then please try to record the episode. That evidence is very, very important for us. That even makes us help to diagnose the seizure. Then for other confirmation, we even ask imaging techniques are there right now. So an MRI imaging or CD imaging, if not possible, the MRI, then EEG test. These all will help us. And so these EEG techniques now, they are very, very advanced tests are available now. So seizure is not just a small thing which we neglect. Later, we know how the person will be affected throughout his life. So please don't neglect a seizure. Please do consult a neurologist or at least a physician first. Then maybe they may throw some light how to proceed, because even in the terminal, not in the cities and towns, most people mm, are aware about it, but in the villages, being in India, we can know that how a seizure is still being treated in the remote areas. So please do, I hope so that this video is very helpful for all of you people out there, and I'm so thankful for giving this opportunity. I'm so thank you.